Namaste, welcome to Nisargwani. Today we have with us Dr. Muthukumar. He is MBBS doctor, completely into training and practice all along in allopathy. But let's know more from him. Now he is known as an acupuncture expert, and he has got an AcuBotic exclusive acupuncture clinic with 15 beds in Chennai. Welcome, Dr. Muthukumar.
Thank you, ma'am.
Thanks for thanks for giving your time to share your views on
I'd be honored.
how acupuncture helps in dealing with the day-to-day health problems. And also, I heard that you are an expert in treating even metabolic disorders, including diabetes. I want you to tell something about that experience.
Ma'am, I'm an allopathy, When I was practicing for 5 years for the initial time, I was very jubilant and I want to do something, a better service to the society. But very unfortunate, whenever you meet a patient with asthma, arthritis, low back pain, cervical, sinusitis, diabetes, what I'm going to do that? I'm simply giving alternative medicine, something like that. And I'll be changing the trade name and will be giving them. That affects me so much. Because I felt guilt. Because they're getting money, but we are not giving them, treating them. That made me to think for an alternative. That time I met a professor in a conference. And he asked me 2 questions in allopathy, which I couldn't give an answer. He asked me, Dr. Muthu, how come, can you define me angina pectoris? I was very reluctant to answer him. In those days, we doctors, we thought we were the highest people, and I stooped down to him. Actually, I was cursing him. He asked me, what is the angina pectoris? I told him, it's a precordial pain, peaking in nature, moderate is the middle pain, more at the tip, the finger. Again, he asked me, when you got a problem in the head, how come you got pain in the little finger? In allopathy, as a medical student, when I asked my professor, whatever start is, it's referred pain. Problem may be severe, it will be manifested somewhere. So, with all resistance, reluctance, I told him, referred pain. He started laughing. I was very much furious. Then I said, look, man, I know my limitation, you tell me. To my worst surprise, he took a picture of a heart meridian, starts here, runs this, ends here. So you take a wire, so potentially more in the end, more in the center. So more pain here, more right pain. I was totally shocked. I always around teachers. So immediately I asked apology. Again, he asked me, Dr. Muthu, gents or ladies, who are using more spectacles? Can you tell me? Sir, honestly telling you, these are not taught in ophthalmology. You make a guess. I thought of some time, and I thought only gents were using more spectacles, even today. I told him, then he asked me, Muthu, your people are coming out of the hut, exposed into sunlight. But ladies are using the hut, illegally eliminated, exposed into cooking gases. How come? I do not know, sir. He took the photographs as articles. Till that time, madam, though as a house surgeon, I would have connected 500 deliveries. I never related the year to one thing till he told me one thing. He said, Muthu, can you ever imagine the saying? This is called as an oracle. In allopathy, for collection someplace and diabetes and nothing more. But he said, this is a fetus, fully grown fetus that is coming out of the mother's womb. See this is a head, trunk, and huddled up. This is how the fetus goes. I was stunned, because I never related that one to the delivery I conducted. This is the point for I. So all ladies, because they are using bimetal, the ear blower, their acute vision is all time the regimented. But you gents, you threw it out. Even though you got a ear piercing ceremony, you don't wear all those things. That is the reason. When he started telling me something which I do not know in allopathy, I was running after. After 3 months of my repeated meeting, then he said, I will teach you acupuncture. That was the way I came to acupuncture. Having come to the acupuncture, I tell you, take it for granted. In India, it's a diabetic hub, they say. Everywhere in the world, they say diabetes is controllable, not treatable. The reason being is, madam, pancreas is involved with the secretion of insulin. And that has been impaired. Automatically, the amount of insulin that has to come to the bloodstream is automatically lessened. So that results in the escalation of the blood sugar in the blood. Simple. Very simple. This is what everybody says. But I said, doctor, what I should do? I should treat the pancreas and make it normal. But very unfortunate, even today, what are the drugs in the market, including injection and tablet, there are supplement to injection, insulin. So it has to be taken daily. One time you leave, it shoots up. So it's okay. You continue for some time. After 3 months or 4 months, your body will become immune for the drugs. So it's even side you taking the drug, your blood sugar will shoot up. So that is the reason, this is the story. In our acupuncture, we got a separate point for pancreas, separate point for secretion of insulin. And they say in spleen meridian is involved with the diabetic. Because spleen and pancreas, embryologically, they are connected one. Like a mushroom, the upper one is a pancreas, the lower stalk is a spleen. That is why we mean, what do you know about spleen and allopathy? You tell me one disease, you tell me one test, nothing. Whenever you see hepatitis splenomegaly, you chop it out, you throw it out, without knowing what is what. But that is the one organ that is very concerned with the transportation and transmission of food and water. Very important. So by stimulating that one, within 22 days of half an hour needle per day, I'll ask them to go for 9-time tests, to go for a graph. Okay, first to start with, I'll bring it down to 180 first fracture. Then I start needling. They'll be taking the diabetic drug, the same dose of medicine, all restrictions, everything. They have to come for half an hour. At the end of the 22nd day, I'll ask them to go for 3 fasting, 3 random and 3 PP. Because 20 is required by the body. Only 10 is coming. 10 you compensate with the drug. So he is comfortable with 20. After the 22 days of needling, some amount of blood sugar will come, insulin will come to the bloodstream. So it becomes 22. So patient will be landing in hypoglycemia for a period of 2 to 4 hours. To identify at which time it goes for the low sugar, I ask them over 9 times so that I can go for a graph. Graph will tell me which part of the day they are landing in hypoglycemia. That time I ask them to taper half a tablet. There after 17 days, another half a tablet. One fine day, believe me, in name of God, they live without tablet. I got more than 5,000 and the patients with phone numbers, everything, and follow for more than 8 years. They have not turned up to be a diabetic. And strictly, we tell them some lifestyle stages. That everything is always. So this is when I started looking at this one. What an amazing art I have done this. In autism, madam, actually the pathogenesis is not known in the entire system. But in acupuncture, what do they say? You got 3 trimesters, you know very well. Third trimester is a one thing. Liver meridian is hyperactive. If the particular mother is upset during that time, the liver meridian will be upset. That results in autism, they say. In olden days, in the 5th month, all the parents, they will take their child back to their home. They'll be treated as a queen. They'll be very comfortable. Here, due to both the people are working, till 9th month, they are facing all sort of problems. That is the only reason you get more number of autistic child today. What happens in autistic child is that brain development is normal. Physical development is normal. Only the cognitive power will not be there. They will not obey to the command. Whatever they want to do, they will do it in a better way. But you can make them, force them to do something.
You cannot.
They'll be the parent without knowing that they are a parent. For if you go to special school, they'll make you habitualization. If somebody comes to say good morning, they will do it mechanically without knowing what they're doing. This cognitive power we can easily stimulate if they come for treatment for 90 days with 30 minutes of kneeling a day. Completely never going to tell you the cognitive power we regain. Thereafter, I asked the parents to appoint a lady to teach some classes. Another 30 days of kneeling with this training. Completely, believing me, in name of God, I can tell you, you can take it to a normal school. More than 3,000 children I would have treated in this autistic child. These are the 2 areas when I could treat it by acupuncture. What else I want?
Yes.
If you treat autistic child, you treat a generation.
Yes. And a burden on parents, you see, it's a 24/7, you are wrong.
If a lady child finish after 14 years, what a mother can do that? That's a great feeling.
Yeah. And I also heard that insomnia and asthma also treated very well in...
What I'm telling you, for each and everything, I know the pathogenesis. But for insomnia, you take it from me, nobody knows what is the reason. Everybody is talking about your tense. You have to bring it down. Very simple. If the man knows how to bring it down, by the time he would have brought it down. But unfortunately, no, insomnia, it comes only because when your heart meridian becomes hyperactive. When I write a letter to somebody, I love you, you draw the diagram of the heart, not of the mind, not of the brain. The reason being is, knowingly or unknowingly, you will see heart houses the mind, according to acupuncture. So any psychiatric problem, insomnia, somnolence, even for somnolence, if you treat the heart meridian, I can show result within 30 days. I got one justice from High Court. He had this insomnia problem for 18 long years. He just came, he wept. Believe me, in 35 days, he was completely normal. And he was very happy and went up. So because we know what is happening in the world, that is the main thing.
So now that you are coming and taking classes for naturopathy doctors who are getting trained in advanced acupuncture, how do you see the combination of naturopathy and acupuncture?
Definitely, man. Naturopathy is 100%. You do not have any side effects. It's the best thing. You are going along with the Tao. Acupuncture believes in Tao. Tao is nature. Once you go out of nature, you will be lacking in problem. But naturopathy, it runs along with the nature. So whatever you do, you are correcting. We don't treat anybody. Something is incorrect, you are setting it right. Simple. That's what I'm doing. We don't treat anything. Flow of energy should be there in all the meridians. If it is being blocked, naturally, some problem will be created. I take a needle, I'm just releasing the block. I take in the flow of energy, they become normal. That is the reason at the age of 52, we treat polio, for which they might have acquired the polio at the age of 6 months. 50 long years of muscle dormancy. How come it comes? You take a lance, dried lance for 10 years. 2 rides, third day you can see greenish. That is movie dharma. And this is dharma dharma. Whichever area there's a flow of chi, it has to do its way. They will be normal. So very simple. According to us, any block will release a block. We don't treat anybody. That is a curative treatment. This is a corrective treatment. Like with your naturopathy is a corrective system. So I love it. Another thing, naturopathy, they got 1 year of study of acupuncture. So the people, they got a basic knowledge of acupuncture. But they should know the nuances of acupuncture also. Then only they can bold enough in going and meeting a patient. Yes. That is where I come. I take the liberty of telling them some nuances which they should know to do the great practice.
And also the success stories will reinforce their confidence.
Each and every time I show all my testimonies are seeing that they've come to know these are the things they could do there in acupuncture. So whenever you talk about acupuncture, man, everybody says it's a painkiller. Nothing what I think about. No, not like that. I have treated the retinitis pigmentosa. I have treated aphasia. I have treated low back pain. The surgery was done. You name anything and everything in my 39 years of experience of seeing daily 100 patients a day. Amazing results I had.
Yeah. Thank you so much. And we are also heading in a big way into bringing acupuncture in maternal care during labor, pre-delivery, antenatal care, and then postnatal care. And we seek your guidance there also.
Ma'am, I was an expert labor in Singapore in painless labor. Yes. We put 6 needles on the abdomen. Actually, we keep a shade the upper abdomen. The lady will be literally fighting with the husband with some family problem. Here you get the contraction, you get the baby done. Oh. So that is also possible. These are the things. Antenatal, postnatal, very clear cut. Only one thing I tell you, man. You tell me what is the result for PCOD? That is a common problem. Everybody knows it. What is PCOD? This is nothing but the heat that has accumulated inside in any secretory gland. We used to have blood tears inside the mouth, in the mucous membrane. Yeah. Because it's a secretory thing, when it becomes hot, it actually becomes an around. The same thing is PCOD, nothing but that. Internal heat that is in the ovary. Once you subdue the heat, once you prevent the production of heat, naturally it goes. Likewise, in anti-patam, postpartum, antepartum, humpty number of things we can do in that. That time I'll be very happy and associate myself. Yes. You are great in Sweden.
Yes. Thank you so much.
Thank you, Best of time. Thanks for the time.